Hi, my name is Alicia Marks, and this is a health promotion presentation for Nursing 110 Medical Surgical Nursing through the University of Charleston on urinary tract infections. I'm going to tell you a little bit more about urinary tract infections. So urinary tract infections, also known as UTIs, are infections of the urinary system. Specifically, UTIs refer to any portion of the urinary tract. This includes the ureters, the bladder, the urethra, and the prostate. So the unifying term urinary tract infection also encompasses cystitis, urethritis, and prostatitis. And an upper UTI is separate from a lower UTI in that it is inflammation of the kidney pelvis. This is also known as pyelonephritis. So pyelo-kidney. So kidney pelvis. UTIs are the second most common infection in the body and the most common hospital-acquired infection, also referred to as a nosocomial infection. And urinary tract infections are most often caused by E. coli, which is found in human stool. Other causative microorganisms include Enterobacteriaceae, such as Klebsiella and Proteus, and Pseudomonas and Staphylococcus saprophyticus. It's a tough word to say. But UTIs are more common in women than in men, and this is due to the female anatomy. So women have a much shorter urethra, 4 inches compared to 20 inches. And this shortens the distance that microorganisms then have to travel from their urethral opening to the lower parts of the urinary tract, where infection can then take root. And another contributing factor for the higher occurrence of UTIs in women is sexual activity. So once bacteria have colonized at the periurethral area, then sexual intercourse can then force that bacteria from the urethra into the bladder. And so a little bit more about the pathophysiology of the UTI. It's very easy to remember when you consider the bacteria and the portal of entry and exit with the body's anatomy. So in the formation of a UTI, bacteria gains access to the urinary bladder and then attaches and colonizes the epithelium of the urinary tract so that it can avoid flushing out during voiding. It then evades the host defense mechanism and initiates inflammation. Now, normally this occurs when fecal organisms ascend from the perineum to the urethra and the bladder and then adhere to the mucosal surface. So think about it this way. If your portal of exit for bacteria in this situation is your rectal opening and your portal of entry for bacteria is your urethral opening, that's not a very long distance to travel. So this makes it easy to remember why fecal organisms are most commonly the cause of UTIs. Other portals of entry for UTI include hematogenesis spread, or bacteria present in the bloodstream from a distant infection, and direct extension by way of fistula from the intestinal tract. Also, urethrovesical reflux, which is the backflow of urine from the urethra into the bladder, can cause bacteria from the urethra to be washed up into the bladder. Clinical manifestations of urinary tract infections include lower back or lower abdominal discomfort and tenderness over the bladder and bladder area, nausea, urinary frequency and urgency, dysuria, voiding small amounts, bladder cramping and spasms. You're going to have feelings of an incomplete bladder emptying and retention of urine, perineal itching, hematuria. Sorry, give me 1 second here. My computer's dying on me. Hematuria, or red-tinged, smoky, coffee-colored urine, pyuria, or white blood cells present in the urine sample, fever, vomiting, nocturia, urethral discharge, and cloudy or foul-smelling urine. So manifestations in older adults may include confusion, incontinence, loss of appetite, hypotension, tachycardia, and fever. And laboratory tests to assess for UTI include urinalysis, urine culture and sensitivity, white blood cell counts and differentials, and sexually transmitted infection testing. So diagnostic procedures to assess for UTI include cystoscopy, cystothroscopy, CT scan, ultrasonography, and transrectal ultrasonography. So the most common complication of urinary tract infections is pyelonephritis, which we previously discussed. And pyelonephritis is an infection inflammation in the kidney pelvis, but it also includes the calyces and the medulla. So pyelonephritis normally begins in the lower urinary tract and ascends to the kidney pelvis. So it normally begins with a UTI in the lower urinary tract, and then it moves upwards to the kidney pelvis. And repeated infections can create scarring that change the blood flow of the kidney, the glomerulus, and the tubular structures. Acute pyelonephritis is an active bacterial infection that most frequently affects women between 20 to 30 years of age. But chronic pyelonephritis is the result of repeated infections that can cause progressive inflammation and scarring. So I will be using the National League of Nursing's Educational Competencies Model, First Outcome, Human Flourishing, and my description of treatment modalities for UTIs. So human flourishing occurs when a nurse advocates for patients and families in ways that promote his or her self-determination and ongoing growth as human beings. Concerning treatment modalities for UTIs, human flourishing comes into play when giving client education. So say your patient and their family are not receptive to teaching, and you have to continue to encourage understanding and adherence in order to advocate for the patient's future health and avoid recurring infections, complications, scarring, all of that. Some management techniques that you might advocate for the UTI are to drink 3 liters of fluid daily. This helps to promote renal blood flow. Bathing every day will promote good body hygiene. Instead of waiting until the bladder is completely full, emptying the bladder every 3 to 4 hours to flush infection from the body. It's going to be really good for you. Just don't wait until you need to void. Just be on a timed bathroom schedule. Drinking cranberry juice will help to decrease the risk of infection. So studies show that drinking cranberry juice for an 8-week period reduces symptoms in women diagnosed with UTI, so ensure you encourage daily intake of cranberry juice. Lastly, human flourishing could be demonstrated by advocating for pain management with a UTI. Pain is quickly relieved once antimicrobial therapy has been initiated, but the addition of antispasmodic analgesics and heat therapy can also be beneficial at relieving pain associated with a UTI. So you don't have to just go with, wait for that antimicrobial to work. You can use an antispasmodic, you can use an analgesic, you can use some heat therapy to relieve some of that discomfort in your patient. So the references that I used for this project were Hinkle, J.L., and Cheever, K.H., 2018, the Medical Surgical Nursing Concepts for Interprofessional Collaborative Care, 9th edition. Walters and Kluter is the company there. And then Holman H. Williams, D. Sommer, S. Johnson, J. Ball, B. Wellis, L. Leahy, P. and Lemon T. 2019 RN Adult Surgical Nursing Review Module, 11th edition, Assessment Technologies Institute, LLC. Then I used Lily L. Collins, S. Snyder J. 2020 Pharmacology in the Nursing Process, 9th edition, Elsevier Inc. Again, my name is Alicia Marks, and this is a health promotion project for Nursing 110 Medical Surgical Nursing through the University of Charleston on urinary tract infections. And I'm just going to give you a quick look here at the board that I've made. We've got urinary tract infections here. These are home remedies for urinary tract infections. So we have drinking plenty of water, taking cranberry juice, drink parsley water is supposed to be helpful. Heating pad, vitamin C boost. And then we have a picture of the urinary tract infection and a picture of the ureters. Here are the kidneys. We have the urinary bladder here. Kind of shows how it progresses. And general urinary tract infection prevention tips. Cleanse your genitals before and after sex. Urinate immediately after sex. Wash your hands. Wash your rectum daily. Again, goes back to E. coli. Drink lots of water. And don't hold your urine. Now, signs of a UTI are cloudy or dark urine, blood in your urine, pain in your pelvic area, burning sensation when you urinate, your urine has a strong odor or increased urgency to urinate. So you have just really extreme urge. Well, that's not going to sit back up there, but... So, this is a health promotion project on UTI, and thank you for your time.